In the Midlands region, we've got 11 ICSs, and I suppose we're trying to work out how do we support these systems to make high quality strategic decisions. They're responsible for billions of pounds of public money. Really we want these systems to be drawing on insight from analysis. We want them to be accessing whatever knowledge or evidence is available, and we want them to be drawing upon those in their decision-making processes. But we're also really keen that they become learning systems. So, when they make decisions, we want them to be routinely evaluating them, and we want them to be working with other systems and sharing their learning. But we recognise that actually this isn't going to just happen. There's a need to build capacity, there's a need to build capability, and there's a need for a bit of a shift in culture as well, if that's going to happen. I'm just going to put up for reference a few documents which I think support our sort of framing of the challenge. The NHS England obviously describe about how analytical skills should be focused on improving outcomes as opposed to just managing contracts and performance. And our friend Ben Goldacre talking about how there's a need for an explosion in high quality analysis. So what we've decided to do in our region is something called decision support units. The idea is that each ICS is developing a team, decision support unit, which is supporting the key strategic decisions that are faced by each system. But just want to make it really clear that this isn't a top-down thing. This isn't something we've been asked to do. This is something that the systems in the Midlands decided was needed. And from the outset, it's had the support of Public Health England, ADAS. We've been working with local authorities, providers, commissioners. And this is essentially about recognition of a need and then systems coming together in order to try and address it. Very agnostic as to structure, but a few things that we have tried to put in place and tried to encourage throughout the region is that each system will have a chief analyst, that each DSU will be multidisciplinary, so skills in quant and qual analysis, evidence, evaluation, and that their work is really clearly separated from some of the day-to-day reporting and routine BI so that they can support those strategic decisions. To give you a little bit of flavour of the sort of questions, things like, what are the most significant inequalities in a patch and how could you address them? What are the areas of variation? Can we sort of systematically think about how, what the thoughts and beliefs of the population are or frontline staff? And also, can we think about how the health and care systems actually interact with the wider economy? So just to give you a sort of flavour of the questions we're thinking about. So each system's got this decision support unit, but actually, as a region, we felt that wasn't enough. There's a need for a far wider network. So each of those systems working with one another and taking the opportunity to share stuff and to work on stuff together. So sharing ideas, coming up with some solutions to some of the problems we all face, peer reviewing work, sharing resources, things like the outputs of projects that we do, or code, or if we've got particularly valuable local experience or expertise, but also increasingly working on some of the shared problems, so delivering analytical projects in partnership between systems. And then right in the middle is, I guess, how we fit in, my team and our team fits in the Decision Support Centre. So the idea is that this network's supported by a Decision Support Centre, and that's hosted by the Strategy Unit, and it's funded by pooled subscriptions from across the region. And our role is, I suppose, it's kind of the glue. We're trying to, actively exchange knowledge between the systems. We're trying to support each of the local DSUs to develop, but we're also undertaking a few sort of select major projects on behalf of the region where actually it makes more sense for them to be done on a once for all basis. So I'll just run you through briefly the main components of our work, and then I'll talk to you a little bit about the progress we've made before we start looking a bit more detail at one of the analytical projects. So we've got this education and development offer, which is essentially about supporting local DSUs to develop themselves. So number of open events and targeted development programs. We've got this rolling program of analytics, but it's not just about us doing a big report. It's very much about us also supporting local systems to take it forward. So, we do a report for each system, but we also share all of our methodology. We share all of our code. We help local teams to think about how they could take the work forward, and that's really important to us. And also around the knowledge exchange, so creating and hosting networks, providing guidance, and this regional knowledge library, which I'll talk about a little more in a moment. So where have we come and where are we going? So I suppose education development, we've done several action learning sets already around various sort of technical skills, but all like system dynamics and quasi-experimental methods, but also some of the sort of broader skills, so leadership development for analysts, which we think are absolutely essential. Some of you on the call might have been to our Insight 2020 festival. We had about 30 events, some great international and nationally regarded speakers. You can still access all of the presentations. I think they're still definitely worth a watch, so I'd encourage you to have a look. But we also do a lot of local support, so supporting local systems to design what their local DSU looks like. And there's a big list there of some of the things that are coming up. Supporting folk to develop skills around evaluation, decision quality and critical thinking for senior leaders, something around operational research methods that we're really proud of. And that's led by my colleague, Professor Mohammed, who many of you will be aware of, is fantastically experienced chap who's published hundreds of peer-reviewed papers. And so it's really quite exciting. The Analytical Programme, we've published our first piece on end-of-life care, which was around looking at the use of health services in the last 2 years of life. And again, as I said, was supported by all that sort of activity to help people translate it into action. But we've got several others, one of which is very imminently being published, and Peter will be talking about in a little bit. So that's around inequalities in access to planned care. We're also publishing a few others as well in the coming months, which I'll let you read rather than me reading out. And there's a number prioritised for delivery over the coming year. So one which is around looking at the link between mental health and physical health problems in people with learning disabilities, and some others as well there. And as I've put there, just a bit more around us supporting that knowledge to action activity, so we're not just doing a report. And then the final component, I suppose, is around active knowledge exchange. So we've got our own established networks, perhaps the most successful of which so far has been the Analyst Network and the Midlands Analyst Network. We tend to get about between 50 and 100 people each time and have our fortnightly huddles and have had some great local speakers. We've published several pieces of guidance which we think are really useful, and our good old Charles Tallack described our guide to evaluation principles and practice as the definitive guide. Our knowledge library is now live, and you can check that out on our website with various evidence reviews and outputs from the analysis that we've done, but also from our local DSU partners. We've got a few things coming up in terms of more publications around supporting knowledge mobilisation. So that's just a real whistle-stop tour through the territory. Just in summary, I guess we think that the DSU network and this model is a really radical development, not just for the Midlands, but we also think it has quite a lot of potential for perhaps the wider health and care service, and it's coming up as a case study in some of the HSEI guidance that's about to be published. But we're really looking to grow the offer so that we can support the folk in the systems in our region to, as we said at the start, come up with better evidence, make better decisions, deliver better outcomes for the populations they serve. But we're really interested in connecting with people as well. So if you're from another region, another system, another organisation, or you're just interested as an individual, if you want to have a bit more of a conversation about our approach, you want to take part, you want to contribute, or maybe you're interested in learning from our experience, we've got our contact details at the end. Drop us a note. We'd love to speak to you.